Do you have the right to live with dignity? Is the question we all know answer to, and that is yes. But do you also have the right to die with dignity? Let's find out. Hello guys, welcome to Legal Imagination. Today we will be exploring the topic euthanasia. Now euthanasia comes from a Greek word which translates literally to good death. It is an intentional act of ending someone's life with the sole motive of eliminating their pain and suffering. Now, before some of you start questioning whether it is even morally right or not to end someone's life, let's look at some of the cases where euthanasia is even considered as an viable option. Euthanasia is only considered as an option when a patient faces severe, irreversible suffering with absolutely no prospect of medical improvements. For example, last stage cancer. This is the most common medical condition leading to euthanasia requests globally. It is considered when malignant tumors cause unimaginable physical pain, respiratory failure, or organ collapse that palliative care can no longer relieve. Then, neurodegenerative diseases. Conditions like amyotrophic lateral sclerosis, Huntington's disease, and advanced Parkinson's disease. Patients consider this option when they face the progressive, irreversible loss of voluntary muscle control, swallowing functions, and the ability to breathe independently. Then third, end stage organ failure. Severe unyielding heart, lung, or kidney failure where medical treatments have been exhausted and the patient is kept alive solely by continuous invasive clinical intervention. Fourth, persistent vegetative state. Cases where a patient has suffered catastrophic brain damage, example from a severe accident or prolonged oxygen deprivation, and remains completely unconscious with zero clinical chances of recovery. In these scenarios, passive euthanasia, the planned withdrawal of the life prolonging equipment like ventilators or feeding tubes, is frequently considered by the medical boards and families. Fifth, severe paralysis. Tetraplegia or total paralysis resulting from spinal cord trauma. While not inherently terminal, it is sometimes evaluated if the patient experiences a complete permanent loss of autonomy coupled with intractable central nerve pain. Sixth, intractable pain. Chronic, agonizing physical pain that is entirely resistant to maximum doses of opioids or specialized palliative sedation. Seventh, treatment resistant mental illness. In a very limited number of European countries like the Netherlands and Belgium, long-term severe psychological suffering is legally considered. This requires a decade-long history of severe depression, borderline personality disorder, or psychosis, where numerous psychiatric treatments, therapies, and hospitalizations have completely failed over time. Okay, so now you have a general idea of what are some of the cases where euthanasia is even considered. Now let's find out what are different forms and methods of euthanasia. There are majorly two methods of euthanasia. The one is active and the second is passive. Then we have two segregations, or we call it classification in these two, that is voluntary and non-voluntary. We also have an involuntary euthanasia, but it is considered murder, so we won't talk about it. So, active euthanasia. In case of active euthanasia, the doctor, physician, or a concerned person actively causes the patient to die by administering some lethal drugs or medicines. In this, there are two types of cases classification. One is voluntary and the other is non-voluntary. In voluntary active euthanasia, patient himself, herself asks or requests the doctor, physician, or family members to do so. While in the case of non-voluntary active euthanasia, the patient is not in a condition to give his consent or to basically ask for it, then in those cases the family members, the physicians and the doctors involved do consult in between themselves, and after reaching to a point they decide that it is better for the patient to go with this process. Then if we talk about passive euthanasia, in case of passive euthanasia, the doctors or medical professionals do not actively do something to cause the death of a patient, but instead it is a practice of intentionally withdrawing or withholding life sustaining medical treatments such as ventilators, dialysis or artificial nutrition from a terminally ill or irreversible unconscious patient. These two consists of two classifications of voluntary and non-voluntary passive euthanasia. Its primary goal is to allow the underlying illness to take its natural course, avoiding futile artificial prolongation of life. Now let's look at all the countries where euthanasia is legally allowed. First of all, we have Netherlands, Belgium, Luxembourg, Canada, Spain, New Zealand, Colombia, and Ecuador. These are some of the countries where active euthanasia is allowed and practiced with specific guidelines and rules that they have to follow. Then we have Switzerland, Austria, Germany, and Italy. These are a few countries where active euthanasia by a doctor is not permitted, but physician assisted suicide, where the patient himself or herself must perform the final act. That is, the patient himself or herself takes the medicine or the life-ending drug. Then in United States, physician assisted suicide is legally permitted in some countries like Oregon, Washington, Vermont, California, Hawaii, New Jersey, Maine, and Montana. Now if we come to India, in India active euthanasia and assisted suicide remain illegal. However, passive euthanasia is legally allowed under strict Supreme Court guidelines for terminally ill patients. We also have another option which is known as living will. In this, the person of above 18 years age has a right where he can make a living will of himself, where he can dictate and clarify all the procedures that he wants or that she wants to go through in case of some terminal illness or a condition where they are not capable of taking any decision. So they make a will where they already specify what should be the procedure that has to be followed, and they also specify that if they are in certain conditions or certain situations where there are no chances of them being revived, then in those conditions they choose or basically specify in advance on those living wills that they want to go through this practice and all. Now I want all of you to comment and share your views and opinions on this and let me know what do you think. Thank you for watching us.